Hi, it's Angie, the Southern Zen Doula, here to answer one of the most common questions that a mother-to-be is going to ask. Why should I choose an epidural over an unmedicated birth? Or why shouldn't I choose an epidural over an unmedicated birth? My first answer to that is education and information. Just you need to be informed about the risks of an epidural, and you need to know that there are things that will happen when you have an unmedicated birth as well. Firstly, with an unmedicated birth, you are going to be a little bit more uncomfortable. However, with a great doula, they are going to be able to help you out with that. If you have a really good, strong birthing team, they're going to be able to help you get through those surges and those waves of pain or uncomfortable times. There are so many different things that a doula can do to help you out during that time, to help get you through. The other thing, though, is that a doula can also help you when you decide to take a medicated route. A doula will never or should never judge you. Everyone in your birth team should be there to support you and support every decision that you make. Make sure that it's an informed decision. And to help you with that, I'm going to give you a little bit of education on what an epidural is. So, first of all, we know the standard place that an epidural goes, which is in the back. A needle is placed in between two vertebrae. So, and that's where the medication is going to go in. An epidural is an anesthesia, but it's a local one. So it's actually kind of more along the lines of an analgesia, which basically just means it's a pain blocker instead of putting you completely under. Now, what happens when you have one? From your waist down, your lower body, if the epidural takes, you shouldn't feel anything. Please do know that sometimes you don't get a complete epidural. Sometimes it works on one side and not the other. This just happens. I honestly don't have the statistics for you on how often it does or does not happen at this point. Just know that it's a possibility. Um, One thing to know too is that the medicines that are in your epidural, you're going to be receiving opioids to help you get all numb and feel nothing below your waist. The opioids that are generally used are fentanyl, epinephrine, morphine, and or clonidine. Now, I bring these up because it is most important that you know what these medications are and what their side effects are. So, an epinephrine is used to constrict the blood vessels to help, to help things go slower and help the medication go in slower. Um, it can also be, it's also one of the things that blocks pain. Um, The thing to know about epinephrine is that it is adrenaline. Adrenaline is actually kind of counterproductive to what you need during labor because what you need is oxytocin. You need your natural oxytocin. This is a wonderful thing that you can actually produce and get yourself by the loving environment around you. Oxytocin is called the love hormone, and it is absolutely a euphoric thing that you can have. A woman's body has the highest amount of oxytocin that it will ever have in her body during labor. If you can have a great support team, a doula that can help you continue amping up that oxytocin and show you how to use it, then that is a great way to block pain and to fall in love with your labor and birth process. Now, thing about adrenaline, like I said, it is very counterintuitive to oxytocin. It'll basically kind of work against it, and that's not what you need. Now, Clonidine. Clonidine is a medication used to treat high blood pressure. Sorry. It's used to treat high blood pressure, ADD, anxiety disorders. This is the main pain blocker in an epidural, but the things that you can experience with it is a depressed system, dizziness, lightheadedness. If you go to sit up, you could possibly faint. You don't want that to happen. Now, these are just possibilities of things that can happen, but they should be known to you. Get up slowly if you have an epidural. You're obviously going to have help. This medicine also, like I said, it depresses the system, so you're going to get a little drowsy with it. You're going to be less alert. And this, later on, in the last stages of labor, may not be the best thing for you. So not only can you not feel the lower half of your body, but the clonidine is something that can make you a little bit nauseous. And as we know, as pregnant women, this is not the best thing. It can happen. I'm not going to guarantee you that it will happen, though, but you need to be aware that it can happen. Morphine was mentioned. Morphine is not really used anymore because it has been proven to depress the breathing in your baby, that the baby is going to come out and have a really hard time breathing. So more than likely, you're not going to run into this. You're not going to run into morphine being in your epidural or morphine being offered to you as any type of pain medication because of its effects on the baby. Make sure that you ask your anesthesiologist when you get hooked up to an epidural the medications that are going in so that you know whether the morphine is in there or not. Fentanyl. Now, this is an opiate that will provide some mild to moderate sedation. So what you have is a chemical cocktail in your epidural that is blocking pain from the waist down, but it's also making your system drowsy and less alert. This is going to have an effect when it comes time to pushing. Your mind may be fuzzy and it may be harder for you to concentrate during that time. Just know these things, and some doctors, they turn off the epidural when it's time to push. Something to discuss with your doctor or your birth team when that time comes. Now, some of the after effects. Because you do have a medication in there that lowers your blood pressure, it can drop rapidly. Your blood pressure is monitored constantly while you are on the medicine for an epidural. You're going to have an IV in to help have ready access to medications that can help your blood pressure rise. Now, and a small amount of people, about 1% of people, get severe headaches from this. Because you're puncturing your spine with a needle, there is a chance of spinal fluid leakage. This leakage is what will create the headache. To combat this, what they do is they take some of your own blood and they put it in the injection site, and this is called a blood patch to help seal it over and prevent that spinal fluid from continuing to get into your system and cause your headache. Now, one thing, I'll get back to, you may experience things like shivering, ringing in your ears, a backache, you're just getting a needle put into your back, soreness at the site of insertion, again, nausea. You also may have trouble urinating. Now, You're numb from the waist down. You may not even know you have to urinate. More than likely, if you have an epidural, you are also going to be catheterized so that you don't have to worry about that. But that's another thing to keep in mind. As I mentioned before, an epidural makes pushing more difficult, and additional medications and interventions may be needed, whether it's a forceps delivery or a vacuum delivery. Because you're unable to feel your lower body, it is a lot difficult for you to feel the muscles and work those muscles that are needed to get baby out. Now, talk to your doctor or your midwife, whoever your caregivers are. Talk to them about further risks. Talk to them about what it would mean if you had an epidural. Make sure that your birthing team knows that even though you have an epidural, you need to switch sides. You need to move side to side. You need to sit up. You're going to need tons of help with that. Doulas have tons of little tricks in their bags for people that have epidurals, so don't fear. A doula is definitely there for you, whether you go medicated or unmedicated. And know that you should never be judged by anyone on your birth team whatsoever. Never by your doula or your doctor or your midwife or anyone else. The question of whether to have an epidural or go unmedicated rests solely with you. You are going to know your body, you're going to know what you need, and you're going to know how you can handle it. I encourage you to look into it a little bit more on the sides of an epidural. I also encourage you to look into more what a doula can help you out with a non-medicated birth. There are fun things that we can do, dancing even, ways to get that oxytocin up and going to help you block the pain and keep going if that is the way that you choose for your birth path to go. I thank you for your time today, and I wish you peace, love, and many blessings.